Canadian originally, and I practiced in Ontario for about 3 years, and I moved to Massachusetts, and I practiced there for the rest of that time, and then since then, I've been down here in Florida.
So you have a lot of experiences with anti-acid medication, right?
Oh, for sure.
Yeah.
Yes.
I think almost everybody took that at a certain period of time. So what's your experiences with that anti-acid?
Okay, there's a number of antacids. I mean, there's the original Tums, you know, you take that, basically very safe. I mean, it's a calcium base, you don't want to take too much of it. If you take it as directed, it helps with an acute problem. You had food that's a little spicy, you take a few Tums, you're okay. And then a good number of years ago, the drug companies came out with something called the H2 blocker. Pepsid, for example, over the counter is one example. And it's still there, it's now over the counter. Initially it was by prescription. And this stops the stomach from producing too much acid. So again, somebody who has excess acidity, it helps. Also somebody who has reflux, where the acid is coming from the stomach up into the esophagus and giving you pain or discomfort at night, by cutting down the amount of acid, it can help for that. It's not indicated for long-term use, although a lot of people do. And then the most recent class are called PPIs, protein pump inhibitors, which is another way of stopping the stomach from producing too much acid. Again, it was meant for somebody, for example, who's diagnosed with an ulcer. Meant for short-term treatment. And the part of the problem with these medicines is not that they're not effective, but for example, somebody has an ulcer and the doctor says, okay, I want you on this for 2 or 3 weeks while your ulcer is healing, and with diet change, etc. Come the end of that period of time and the patient starts to stop it. Well, when you stop these medicines suddenly, the body reacts not only by producing the original amount of acid, by a little excess acid. Patient develops some symptoms. Oh, I'm not better yet. Even though they may be healed, they just have some excess acid. So they'll go back on it. So patients have been on this PPI for years, because every time they try to come off it, you get this rebound hyperacidity.
Well, what's the side effect if they take years?
Most recently, it's been linked with dementia.
Dementia?
Yes.
Whoa, because people cannot absorb nutrients well? Or?
I'm not quite sure the science behind it. I think that's probably part of it, and maybe another effect of how the medicine is working. And part of the issue, I think, is if you know something's going to happen, if your provider says to you, you know, I want you to stop it, and if you get a little excess acid, take some Tums. It would solve the problem, you're off the medicine. You know, so there are some medicines which we put people on for a limited period, but because they're now over the counter, it used to be you needed a prescription. So the provider could say, yes, you're going to be on it for 2 weeks. That's when your prescription runs out. If there's a problem, call me, and they could work it through. If you look at reflux, you know, very common, at the end of our esophagus, there's a valve-like medicine which is supposed to prevent acid from going up there.
Yes.
Sometimes that becomes a little incompetent, so acid comes up. An excellent way of solving that problem is putting it under the head of your bed, not under your pillow, a small 2x4, just raising the head of your bed, using gravity to solve the problem. So at night, instead of lying flat, you're up just a little bit. That is a very effective non-drug solution. You don't have to use medicine, and it cuts down away the use of medicine. Because unfortunately, not that you're going to get many side effects, say for the Pepsid, this H2 blocker, but suddenly people are put on other medicines. And if you have one medicine with another, you can get drug interactions.
Yes.
And if you start getting drug interactions, now you're causing problems where you want to be solving them.
Yes, yes. So what is the longest time people can safely take that? Like a few months?
Maybe it depends what you're treating, but if you're talking about a gastric ulcer, and it's not responding to treatment, to that type of treatment, that's when you go back to your doctor and say, listen, I've been on whatever you prescribed for me, what you told me to take, even though they're over the counter, and I'm still having problems. That's where you have to do more tests. You know, if you and to diagnose an ulcer, of course, somebody's had to look down your stomach or do an X-ray where you swallow the barium, and they can look at the inside of your stomach. And if you're not getting better, then you would move on to the future plan that your specialist, your doctor would have for you.
That's right, yes. So I heard that if you block the acid too much, then you cannot absorb like minerals and vitamins.
Yeah, it can make a difference. So that's why you want to use any medication for the minimal time. Now we're not talking about something like high blood pressure or diabetes, where we can't cure the problem in the vast majority of time, and it requires lifelong medication. For somebody who has high blood pressure, and 95% of high blood pressure, we don't know why. There's a small percentage of people that have another cause we can treat, and the blood pressure goes away. But for diabetes, once you're on these medicines, there are some medicines that are long-term for the rest of your life. But something like an antacid, medicines for sleep. There, some people when they travel, when they're in a very stressful situation, a family member is sick, there's a lot of trauma. Nothing wrong with using something short-term while there's a problem.
Yes.
But again, they've shown that once somebody gets onto, let's say, a sleep med, and there's people who've been on sleep meds for years, probably the medicine's not doing anything. It's just the fact of taking that medicine
makes them sleep. Yes.
It's called the placebo effect.
That's right. Yes.
And that is a major effect.
Yes, that's right. So they should stop for.
Ideally, they should stop, but it's also learning about it. There's a very interesting study. I don't know if you've heard of irritable bowel syndrome.
Yes, IBS.
IBS. And there is a wonderful physician at Harvard who diagnoses his patients with irritable bowel. And once he does that, he said, I'm going to treat you with a placebo, and explains to the patient what a placebo is and how it works. And then he says to the patient, if this placebo doesn't work, you're going to come back for a stronger one. His results are as good as any prescription medicine that we can give.
For this particular
for IBS.
Yes, okay.
And so it says that it's very interesting how much our mind and our body are connected, and our belief system. If I think that I'm taking a pill that's going to do something.
Yes.
And just to give you another example, if you come to me and you have high blood pressure, let's use that as an example. And I say to you, we've got to add another medicine to your blood pressure. It's not where we want it to be. And I say to you, there's a new medicine out there. I think it may be okay if you want to try it. Versus, there's this great new medicine I read about. I've been getting wonderful results from my patients, and I'd like you to try it. In which case do you think you'll have a better response?
Of course, that one you think is the better,
yes,
wonderful medication.
Because it's our belief, our mind can influence. Can really influence how we do. And that goes for any medicine. When we started off with antacid.
Yes.
If I think I'm going to do really well, I'm most likely. If you're going out to, let's move it out of medicine a little bit. If you're going out for a social event, say, oh no, I don't know if I'm going to have a great time. You may not have a good time. You think, gee, I'm really looking forward to meeting some new people and seeing some old friends.
Yes.
You're most likely going to have a better time.
That's right.
And you move that into medicine. And it's a different way, maybe, of looking things. Another problem that I think people don't realize, once we're put on many medicines, it's often a good idea to ask your doctor, could you do a drug information check? see if all the medicines I've been put on
Mm-hmm.
are interacting with each other.
That's
Because
right.
it often happens by pharmacies if you're always using the same pharmacy, but we always don't do that.
That's right.
If we change physicians because of our insurance changes, we move, this doesn't happen. So if we add one of the PPIs to something for sleep, for our blood pressure, if we happen to have diabetes, any of the chronic conditions, it's worthwhile to check.
Yes. Yeah. So kidney, we need to protect the kidney.
You want to protect the kidney, you want to
The
protect
liver.
your liver.
Uh-huh.